Hello, ma'am. How are you doing today?
Great, how are you doing, sir?
I'm doing well, doing
Thank
well.
you.
So I understand you were a little curious on how your mother was doing in therapy after her surgery. Is that right?
Yes, sir.
Okay. So about the surgery, she had a total hip replacement.
Right.
And pretty much what they did is this leg bone, the femur,
Okay.
they took the head off because it was weak, it was really soft, and so they put a new head with a metal implant, new head of this leg bone,
Okay.
and put a new hip joint in completely. She has a totally new hip joint. And so along with that, there's a few things that she cannot do,
Okay.
precautions that we cannot have her break. And so this leg, we cannot have her bringing it in past her belly button, past
Okay.
the midline, because there's a risk of dislocation here. And then likewise, she cannot bring her toe towards the inside. We
Okay.
want her toe pointing straight up. So could you repeat that first one back to me?
Yes, so this leg, it cannot go past the belly button, past the midline.
Yes.
And
correct.
then the toe cannot be angled in.
Yes, yes,
Okay,
great job.
great.
Okay, and then the last one, very important, she cannot bring her knee up to her chest or bring her chest down to her knee. So standing up is what we're working on. It's kind of hard to stand up without being able to do that. You want this to be open
Okay.
past 90 degrees, kind of like open like a book.
Okay,
So,
so she can't bring her knee up above her hip,
correct.
and then she can't lean past that angle.
Right.
To leave that open. Okay,
Yeah.
that makes sense.
Yeah, so good job. And so
Okay.
we're just working on that with her. And as far as therapy goes, I mean, we've been seeing her for a week and she's been progressing. There's still a little bit of pain, but progressing in strength. And so
Good.
that's really the goal of, we want to build strength all around the hip areas. And so we've also been working on getting her standing and walking with a walker.
Mhm.
And so
Good.
that's really the most important thing. We want her to walk 200 feet with this walker and comfortably, and learn how to be more independent. And hopefully in 4 to 6 weeks, we're thinking her going back home. So that's kind of the time frame we're thinking for right now. But she's doing well, and she's almost to that 200 feet mark with her walker. She's about 100
Great.
feet right now.
Great.
And so, but yeah, she's improving, and I think that's, is there any other questions you had? Or
Those were the questions of what she was allowed to do and how the movement's at home. So
Okay.
I think I've got it. That's
okay,
great.
yeah, sounds good. Oh, and she's not able to put full weight on that leg.
Sure,
It's partial weight bearing. So the doctor just want to be really clear on
Yeah,
that.
okay.
So, but yeah, other than that, she's doing really well. Is there anything
Excellent.
else?
No, we're pleased with the progress.
Okay,
Thank you.
sounds good. Thank
All
you.
right, appreciate it.
Yep.
Thank you.